Some of the initial concerns that the patients have are, will it look natural? And nowadays, I think the expectation is more that it will be natural, but density now becomes naturalness. So people expect it to be natural, and they expect that all of the doctors do it the same way. And now they're looking for more density. So that's why you need larger sessions. But it's still important to make it look very natural so that people can't pick up what's a hair transplant and what's not. I think when you look at the results of hair transplants, there's two things you need to look at. One of them is the patient's expectations, and the other one is the actual result itself. In some situations, the patient's expectations, if you can meet them, they're happy. But I want to be able to look at it myself and say, I not only met their expectations, but I met my expectations, because I want to be able to give them the best hair transplant possible. And in order to do that, it's a combination of things. And the two most important are the natural look of the hair transplant, how you actually set the direction, the angle in many different directions, and also the density. So you need to do larger sessions and be able to really fill in more quickly in less sessions to be able to give them what I would consider a great result. I think in general the techniques throughout the country, or the world for that matter, are fairly similar. But what differentiates specifically one doctor from another is their artistic ability and their attention to detail. Without either of those, then it just becomes a hair transplant. But with those models involved of having both artistic ability and attention to detail, you end up with a really fine picture, you end up with a fine result. One of the important differences for us at DiStefano Hair Restoration Centers is we're able to do large sessions all the time. How that benefits the patient is that there's not an increased time for healing, there's not an increased pain, there's no increased recovery time, and therefore they can do in one session what others can do in 2 or even 3 sessions. So our goal is to really get the patients to a place where they want to be so that they can have the natural look, take years off the way they look, and make them feel much more comfortable with themselves. The biggest thing that I hear from my patients is someone told me, I lost weight. Did you shave your beard? Did you get a new hairstyle? You know, most of the time, the hair is supposed to be there. So when you put the hair back and it looks natural and it looks dense like it's supposed to, people accept it that that's the way it's supposed to be on the outside, not the patients, but on the outside. So my patients are constantly being asked questions of, what did you do to yourself? And they don't specifically mention hair because it looks so natural. People don't know that it's the hair. They think it's something else. So they want to know, why do you look better? Do you look better because you have new clothes on? Do you look better because you shaved your beard or your mustache? No, I look better because I have hair now. It's something I didn't have before.